Hello everyone, my name is Emily Rodriguez, and today I'll be presenting on radiology in the diagnosis of lung diseases, specifically how imaging technologies like X-rays and CT scans help doctors detect and monitor diseases in the lungs. Our lungs are vital for breathing and oxygen exchange. However, when they're affected by disease, it can be life-threatening, which is why early and accurate diagnosis is so important. That's where radiology comes in. Imaging techniques allows us to look inside the body non-invasively, helping detect problems we can't see from the outside. Let's briefly review the main imaging tools used. Firstly, we have chest x-rays, which are first-line imaging tests for lung diseases. They are quick and cost-effective for initial diagnosis. Secondly, we have CT scans, which provide higher resolution images, which make it essential for detecting lung nodules, tumors, and embolisms, which gives us a more detailed view. MRI is rarely used for lungs but can be helpful in special cases, specifically where radiation exposure should be minimized, for example, to pregnant patients. Common lung diseases presented are pneumonia, COPD, lung cancer, tuberculosis, pulmonary embolism, and pulmonary fibrosis. First, let's talk about pneumonia, an infection that inflames the air sacs in one or both lungs. Doctors typically use a chest x-ray to look for areas of whiteness called consolidation, which shows fluid or pus. More complex cases may need a CT scan, which can detect complications like abscesses or pleural effusion. Imaging also helps determine if the pneumonia is likely viral or bacterial and tracks how well the patient responds to antibiotics and treatment. Chronic obstructive pulmonary disease is a long-term condition often caused by smoking. It includes emphysema and chronic bronchitis. On a chest x-ray or CT scan, doctors may see overinflated lungs, a flattened diaphragm, or large empty spaces in the lungs. These images help doctors assess the severity and decide on treatments like inhalers, oxygen therapy, or even surgery. Lung cancer is one of the most leading causes of death. It often starts as a small nodule or a mass visible on a chest x-ray, but a more detailing imaging is used. A CT scan, for example, helps guide biopsy procedures and plan surgery or radiation. Pulmonary disease is a blood clot in the lung, and it's diagnosed using CT pulmonary angiography, which can reveal blocked arteries. Tuberculosis is a bacterial lung infection. X-rays may show cavities in the upper lung or a military pattern of tiny dots if it had spread. Both of these are life-threatening, and without imaging to confirm them quickly, they can be deadly. This group, pulmonary fibrosis, is where the lung tissue becomes scarred. Doctors rely on high-resolution CT scans, which show a honeycombing pattern. These patterns are key to diagnosing and staging the disease accurately. This chest x-ray shows findings from a 35-year-old man patient who presented cough and fever, which are classic symptoms of bacterial pneumonia. On the posterior anterior, there is airspace consolidation visible in the right lower lung space. What's happening here is that the alveoli are filled with fluid and pus, making them appear dense on the X-ray, while the air-filled bronchi stay visible as dark streaks. This image is a classic and important example of how radiology helps us accurately localize and diagnose lung infections like pneumonia and ensures we can start the right treatment quickly. Of course, there's future trends in radiology. One of them is low-dose CT screening, which can be used for lung cancer screening in high-risk patients like long-term smokers. Secondly, we have functional imaging, which pretty much means new techniques like functional MRI, which can visualize airflow and lung function, which offers exciting possibilities for the future. And of course, we have AI-assisted diagnosis, which helps radiologists detect diseases early and more accurately. I wanted to provide a small fun fact, which radiology pretty much can detect lung diseases before symptoms start. Because CT scans can detect tiny nodules or early signs of lung cancer long before a patient shows symptoms, it pretty much means that this can be especially useful in smokers or people with high risk of lung disease because early detection means saving lives. To wrap up, radiology is essential in the diagnosis and management of lung diseases. It allows doctors to detect illness early, guide treatments, and monitor recovery. As technology evolves, radiology will continue to play a crucial role in saving lives and improving patient outcomes. These are my resources. Thank you so much for listening.